My name is Maureen Dobbins, and I'm a professor in the School of Nursing at McMaster University and the Scientific Director of the National Collaborating Center for Methods and Tools. And it is my pleasure to speak to you today about the role of evidence-based research in the knowledge to action cycle. So just in terms of what I will speak about today, I'm going to briefly describe the knowledge to action cycle from one particular model, the KTA model, that's very familiar to many of us here in Canada and likely elsewhere. Discuss the evidence-based research in relation to the KTA cycle, and then use an example of some work that my center that has been involved with to talk about supporting decision makers with high quality evidence during COVID-19. So what you'll see before you here is the knowledge to action model, or we call it the KTA here in Canada. It might be familiar to some of you. This was created a number of years ago, and it really supported the foundation for our national health research funder, the Canadian Institutes of Health Research, in terms of providing a framework for researchers to think about how to support the use of evidence in practice. And so just really briefly, what you see in the middle of this model is an upside down triangle. This part of the model is the generation of knowledge or evidence. We see that progressing from knowledge inquiry, which would be our single studies, to knowledge syntheses, to various knowledge products that are then made available to help inform action. And that's where we move to the outer circle that goes around that triangle that starts with identifying a problem. And then as we move to the left and up, it involves assessing barriers to knowledge use, adapting knowledge to the local context, selecting and tailoring your implementation interventions, thinking about how you're going to monitor knowledge use, how you're going to evaluate the outcomes of implementation, and then how you're going to sustain knowledge. And so many of us might think about at this conference, evidence-based research and the use of evidence as it relates to the tremendous amount of evidence that's being created every day, week, and month about health issues. And I give you just one example here. I did a quick search of healthevidence.org, which is a repository of systematic reviews evaluating public health interventions. And just looking at the last 5 years, I searched for reviews that were keyworded with 2 words, physical activity, or 2 terms, physical activity and community. And you can see here that 502 reviews were identified in that repository. And when I further limited to just children, there were 81 reviews that are relevant to physical activity in the community and relevant for children just in the last 5 years alone. So, you know, we've heard these stories before where there's a tremendous amount of research going on in health areas, and we need to be better at not duplicating research, at understanding where the evidence base is and building off of that evidence. But I wondered, do we have a similar type of issue when it comes to knowledge translation and the availability of evidence? Do we have that same issue where many, many studies are being conducted on various aspects of the knowledge to action cycle that doesn't take into account the previous research and the knowledge that's already known about those factors? So I did a little bit of searching, and I'm by no means am I an expert at searching, so you may not be able to replicate these numbers, but just really quickly, I took a look at PubMed, and I used the words knowledge translation as keywords, and I just limited that search to the last 5 years and found over 76,000 articles. And then when I limited that to systematic reviews, there were over 1,800. And when I just limited to randomized control trials, there were almost 2,000. So of course, there's many other words that could be used to find all of the evidence that is relevant to evidence-based, practice, to knowledge translation, to dissemination and implementation. So we would need many more terms in order to have a comprehensive search, but this starts to give us a magnitude that maybe there is an issue going on here in terms of are we really optimizing the evidence that we already have in knowledge translation to inform the research that is happening now on various aspects related to the action cycle? So let's keep looking. I decided to see, of those 76,000 articles, how many of those might be related to barriers. And again, found 187 just in the last 5 years related to the barriers. And keep in mind, this is after decades of research published about the barriers and facilitators to use of evidence. And in fact, really many years ago, calling for, stopping of doing these types of studies. And so let's keep going. I thought, well, this is one model here of dissemination, the knowledge to action cycle. But there, I wondered, how many more models are there? So there's this excellent site that you can go to, listed, the link listed here. And we can see on this site that there are 110 dissemination and implementation models that have been identified. It's a fantastic site to really help someone identify a model that could be very useful in their local setting without having to do a lot of reading yourself to learn about the many models. So it's a great site. I encourage you to go to take a look at it. Very user-friendly, easy to search, to really focus in on finding a model that would be quickly, that would be good for you to use. But really what I just wanted to point out here is, in a field that's relatively young, knowledge translation, 110 models and frameworks identified in probably the last 20 years at most. Do we really need all of those? Again, are we really optimizing our knowledge of what already exists before we start developing our own take, our own model? So just something to think about there. I wondered what was there around our implementation intervention. So just very, very simple search identified over 3,500 articles that were labeled as something to do with knowledge translation interventions. And then jumping over just to sustaining knowledge. And again, in PubMed identified almost 400 studies that were labeled with knowledge translation and sustaining. So really just a whirlwind tour around the knowledge to action cycle to really, ask us to be thinking about what evidence already exists. How can we best leverage and use the knowledge that has been accumulating over the years with respect to knowledge translation, and really use that to inform our next studies, looking to whether or not there are high quality syntheses in each of these areas, of which there are, that we can use, and thinking carefully about, if we're going to do a primary study in any one of these areas, being really sure that there aren't already studies that have done that. What would be the unique value of doing another study in a similar topic area, and being really clear about what that contribution to the literature in evidence-based research will be. So now I just want to change gears a little bit and talk about a rapid evidence service that my center started very early in the pandemic, really at the request of decision makers. So normally we're an organization that helps build capacity amongst decision makers to use the best available evidence in their decision making. We weren't pre-COVID an organization that conducted syntheses, but we were very knowledgeable about how to do them and really helped others get those skills so that they could do them and use that to inform their decision making. But very quickly during COVID, quickly as in the first few weeks, we significantly pivoted from what we had been doing in terms of training to conducting evidence syntheses when we started receiving multiple requests from public health decision makers at multiple levels in the country asking us for that evidence. And so what we really created, we refer to as our rapid evidence service. And it's really a bit of a relay race in terms of we have specific staff assigned to do different parts of the evidence synthesis process, as you can see down the right-hand side here. And when one activity is done, then it's passed off to another staff member who then completes that part, and it's then passed on to the next person and the next person, and so on. And so we prioritize questions received. The number of questions, particularly early on in COVID, far exceeded the capacity that we had to complete them. We are building on a report that we had released previously, which was a rapid review guidebook. That was the basis for the beginning of our methods that is informed by looking at many other evidence synthesis groups internationally around the world. And when COVID first began, we endeavored to complete these reviews within 5 to 10 days. With respect to receiving and prioritizing questions, as I said, we're getting them from the federal level, provincial, territorial, local organizations, even some international questions. And so what we developed was a weekly team meeting where we do two things. We assess the progress on our current reviews, and we also assess our capacity to start new reviews and then schedule them out. With respect to prioritization, we number one, try to avoid duplication. So as many are aware, many jumped into the evidence synthesis world when COVID started. And so there were many groups simultaneously completing reviews on the same topics with the same studies at the same time. And so we really wanted to do as best we could to avoid that duplication. And one of the groups, we became a part of COVID-END, which is the COVID-19 evidence network to support decision-making of well over 50 organizations internationally. And we would reach out and search that network to see if a review was already completed, was in the process of being done before we would accept to do that review. We also assessed urgency and relevance to the Canadian contents. We looked at whether or not we had the content expertise in-house to address the question. And we also assessed whether or not there was any available evidence, useful evidence to answer the question. And sometimes there just really wasn't evidence available to answer the question. And so then that was what we provided back to the requester, is that we didn't feel that question was a viable question at that time and perhaps could be revisited. Formulating the question is really an important piece of the process and requires an opportunity to connect with the requester to make sure we understand the question properly and to really ensure that that question is as refined as possible. And I give you one example here of a living rapid review that we've been updating since April of 2020 related to schools and daycares and the role of COVID-19. So we collaborate with the requester, and through that process of really refining the question, then that also helps us develop our inclusion and exclusion criteria, which we share with the requester ahead of time to make sure that we're on track. Searching as well, we really focused on the predominantly COVID-19 databases, of which a great many evolved at the beginning of the pandemic. We limit our search to English language. We then look at peer-reviewed sources as well as preprints. And then depending on the question, we look at the gray literature and sometimes jurisdictional data as well. So for example, sometimes there really isn't very much in terms of scientific studies, but there is local epidemiological data that is available that can help inform what we know about a particular phenomenon. And so we would look for that. And then always, always prioritizing syntheses before we would do a search for single studies. And try to be as comprehensive as possible in terms of looking at those syntheses, looking for high quality and current syntheses before embarking on doing our own. Screening, that was carried out by a single reviewer at the title and abstract screening. And so of course we've labeled these rapid reviews, and there are trade-offs with rapid reviews. It's not a full systematic review, it's being done in days. And so one of the trade-offs that we did was to use a single reviewer as opposed to double reviewers at the title abstract. We've also been using Distiller SR, which is a platform to help support syntheses, an electronic platform. And one of the functions of this is called DAISY re-rank an AI function. And so as you screen through your results and identify relevant results, then DAISY learns what appears relevant and will re-rank your result set in order of most likely to be relevant from the top to the bottom. So that allows us to more quickly identify the studies at the top that are most likely relevant, and we can get to work on processing them in terms of quality appraisal and data extraction while someone else is continuing to finish that screen, because we know we're quite likely to not find much else that's relevant as we go through that. So a very, very helpful use of AI in that context. Of course, some of the sources, the COVID sources, need to be manually screened, and we track those results in Excel. We also then use a single reviewer for full text screening, but this is double checked by the lead author of the review when we get to that part of the review. If we now move on to data extraction, this is an example of what our data extraction tool looks like. And it's also been informed by what our decision makers have told us they want and what they don't want in the report. And so here, the data extraction again is conducted by one reviewer and is checked by the lead author. And we extract information on the design, the population, the settings, summary of findings, quality rating, and any other relevant info for that particular topic question. Critical appraisal was something that was an absolute must, or is an absolute must for the rapid reviews that we do. They are completed by one reviewer and then verified by a second reviewer, and any conflicts are resolved through discussion, and if needed, the lead author will also provide input. We're using a variety of tools to coincide with the huge variation in study designs that we're seeing, and you see a few examples here of the ones that we've used, and then we rate each study. We give each study a rating such as strong, moderate, or low quality. We were absolutely not willing to forego the critical appraisal for speed. We know that throughout the pandemic, that as much as 40% of the emerging evidence was available through preprints, which means that it wasn't peer reviewed, and therefore that made the quality appraisal that much more important. About 4 months into our rapid reviews, then we also started applying grade. And this was a really important new development in the methods that really added, I think, to the rigor of the reviews and really helped with the certainty of the findings. What we were realizing before that was, even though we were appraising the quality of the individual studies, some topics really had the designs were all designs that were at very high risk of bias. And so while it was a well done study, there was still a fair amount of risk of bias in the body of literature, but that wasn't being captured when we weren't using grade. And so we started applying grade to really answer that question: how likely are the findings to change with more evidence? And we've used these 8 domains listed here to either upgrade or downgrade the evidence to be able to provide that rating of very low, low, moderate, or strong. And then just in terms of what our final product looks like. So the final product looks completely different from anything we've ever done in terms of an evidence synthesis, or what we've provided mentorship on or training on in terms of writing up the results of an evidence synthesis. This, again, it has been really informed by what our policymakers were saying they needed, and conversely what they didn't need in terms of having days to look at the evidence. So we completed a few reviews very early on, and received feedback back saying, no, this isn't what we need or what we want. And they gave us some examples of the types of templates that would allow them to search through the findings quickly. And that's how this particular product came to be. And so the first page always starts with very upfront, what is the question being answered? We then have an executive summary that's made up of 3 parts: the key findings and certainty. If it's an update, we talk about what's changed. We give an overview of the evidence. Then we talk about methods. And again, it's fairly bare-boned methods. If you want to know more, there's links to specific pages on our website that give more detail. And then the bulk of the information exists in the results tables according to the types of columns that our decision makers were interested in. So in terms of page 2, the executive summary will look like this. It'll have a background section, not more than 1 to 2 paragraphs. Our key points, so what were the most important key things that we found in terms of that synthesis, and each of those is linked to a grade statement. We then provide an overview of the evidence and identify if there are any knowledge gaps. That's usually 3 to 5 statements. We also identify if there's anything specific for different types of populations, or if that continues to be a gap. And then finally, if there is an update, we would have an additional paragraph that clearly articulates what has changed since the previous time that we completed this review. As we're doing grade, we have a summary of findings table. This is what it looks like if we're looking at quantitative studies, and then per outcome, we will identify the study design, the number of studies, and our overall certainty of the evidence, as well as the reasons for upgrading or downgrading. And we also have done rapid reviews that have looked at the qualitative literature. And so here's a summary of findings table for that qualitative literature, also identifying what issues led to the upgrading or downgrading. So just a little bit in terms of dissemination. And so for those of you that have been helping to support policymakers and decision makers during COVID, know that this has been extremely challenging in terms of knowing how do we get this information into the hands of the people who need it, or in front of their eyes. So one of the things we did was to create its own page on our website so that folks could quickly go to it if they wanted to. Between May 2020 and June 2021, we completed 65 either reviews or updates. And then we used a variety of strategies to help people become aware of that evidence. We posted new reviews to the website. We created an email notification system so one could subscribe to be notified every time we add something new to this page. And really, we are very excited to know that well over 200 decision makers and policymakers quickly signed up for that when we first created the page. We've been very active on social media. we include them in our monthly newsletter, and we've also partnered with McMaster's communications team on particular reviews that were very timely with decisions that were being made or about to be made, and that has really helped as they were helping to get the word out. Just in terms of impact, it does seem like this service is meeting a need. We know that the page has been viewed more than 35,000 times from June 2020 to September 21. We've received questions from not only within Canada, but outside of Canada. We're collaborating with other national organizations on reviews together, which has really been fantastic to do. And we know that these rapid reviews have been indexed in a number of the COVID databases, and certainly it has garnered a fair amount of media attention to hear more about the results. And as you can see here on the right-hand side, it's been accessed by folks in more than 160 countries. But of course, there have been challenges, and we've had to reflect on this many, many times throughout. Nothing has stayed constant as it relates to our methods, and particularly in keeping up to date as the COVID ecosystem, evidence ecosystem evolves, then the rapid review methods also need to evolve to coincide. So it's really hard to balance rigor with feasibility, speed with rigor, and trying to find that balance to produce the most rigorous product in the shortest amount of time, and how can we feasibly do that. It has also been extremely challenging to minimize duplication. So when you're spending all of your effort trying to complete these reviews as quickly as possible, it's hard to consistently do and continuously do all of the searching to make sure that someone else hasn't already done that topic. And sometimes it is good to have more than one group do the same topic, but just trying to make sure that we keep that duplication to a minimal as possible. And so, of course, there needs to be better ways of staying abreast of all of the evidence synthesis efforts that are going on. And something that I think, you know, as we move towards post-COVID, how do we do that into the future? The next comment of getting the right info into the hands of the right people at the right time. All of our decision makers are so incredibly busy, they don't have time to be reading email or keeping up to date on some of what may have been newsletters or traditional ways of accessing. So we really need to think carefully about how do we get that info? Who are the folks that are funneling the information to those decision makers, building relationships? And that was one of the things that worked for us in terms of groups that were compiling the evidence and providing that for decision makers and policy makers for specific meetings. Trying to be proactive instead of reactive. And so many of us have struggled with this and just always trying to keep up, but sometimes trying to think of what will be the next crisis 1 month, 2 months, 6 months down the road. Can we get ahead of this and start guesstimating what those questions are going to be, because maybe we could get started on looking at the evidence now. So that balance between it being reactive to the questions, but also thinking to the future, what else needs to be answered, and can we start on that now? When is the evidence out of date? Definitely a challenge. We know some of the rapid reviews on the day that we published them, posted them to our website, there was already new studies that had come out, and they were now not in our review. And we thought, should we still post it or not? So we've all grappled with that. And of course, out of date has changed dramatically during COVID from months and years to now being even days. And so really thinking about what does that mean for our rapid reviews? What did we also have grappled with when we have not updated a rapid review? We haven't updated all of them. then should we leave it on our website or should we take it down because now it's out of date? So happy to have more discussion in our question period about that. We've also thinking about how useful is the evidence from other jurisdictions to Canada. So really that local applicability has been really important in terms of what evidence to focus looking at. And then as many of us will have encountered is, you know, the signal to noise ratio, low quality evidence. How can we make sure that we have our decision makers accessing the best evidence being collected. And so I just want to finish on the work that Dr. John Lavis and Dr. Jeremy Giramshaw have been co-leading on the Global Commission on Evidence. Some of you may be aware of this, but this is really an instrumental piece of work that John and others have been working on to really take advantage of this appetite for evidence that COVID has created, but trying to ensure that we have balance in that evidence so that decision makers have all of the best evidence to really inform their decision making. And so they have pulled together 25 commissioners who are carefully thinking about that evidence ecosystem for the future and what are the burning questions that really need to be answered in order to help influence the creation of platforms and mechanisms that will ensure that decision makers and policymakers can access that best evidence in their decision making. And there is so much on the website that they've already done that I can't do justice to it in speaking to it in just a few minutes. And so I will keep it at that. There's many ways for you to familiarize yourself with what's there. Visit the website. They have a newsletter, they're on Twitter, LinkedIn, and really hoping that you'll have others that will take a look at this, contribute feedback to this, and just one other way that you can get a hold of them. So you'll have the slides and you'll be able to access that. So with that, that brings my presentation to an end. I thank you for listening and I look forward to the discussion to come. Thanks very much.